I'd like to introduce our moderator, Dr. Noreen Khan. Dr. Khan's the founder and CEO of Access Point Healthcare, an organization specializing in delivering a full range of services to healthcare organizations and leaders to optimize hospital strategies with patient-centered care, access to care, operations, and technology. Dr. Khan has received her medical degree from Rawalpindi Medical College and did her internship in pediatric radiology at Boston City Hospital. She was awarded a distinction certificate in healthcare innovation and entrepreneurship from Duke University and her MBA in healthcare at George Washington University. Dr. Khan currently serves on the board for the Clay County Schools Health Advisory Committee to fight childhood obesity and is named the 2015 Malcolm Baldrige National Quality Award Board of Examiners and is currently serving on the MBN QA and ACHA NCAL board at national level as a healthcare sector expert to help improve and promote performance excellence. Dr.
Thank you. Good afternoon. Thank you, Terry. Thank you, JU, for hosting the event. It's been really a long day, but I would like to start with a little intro to the Baldrige program. Baldrige National Quality Award was developed in 1987 to enhance competitiveness of U.S. businesses. Its scopes was since expanded to healthcare education organization in 1999 and to the non-profit and government organizations in 2005. The award recognizes achievements in quality and business performance and is based on a strong framework of organizational excellence. Baldrige criteria are flexible enough to encompass a wide variety of methodologies in supporting quality and performance excellence globally. State, local, and regional Baldrige Award programs use the Baldrige criteria to advance improvements in their states and regions. These programs help many local organizations to start or continue their performance journey. Many healthcare organizations, without their plans of applying for the award, they participate and use their Baldrige criteria to improve their quality and pursue their excellence. The framework Baldrige offers addresses a variety of criteria in categories of leadership, strategic planning, focus on patients, the customers and markets, measurements, analysis, and knowledge management, staff focus, and also to the operations and organizational results. Over the if we go back 2 years, Baldrige has started developing cybersecurity framework. It's a great tool to secure digital assets, not only to help organizations understand their cybersecurity risk, but also to reduce these risks with customized measures. And right now, we have about 30% of US organizations using this cybersecurity framework. And according to our research, by 2020, 50% of US organizations will be using the cybersecurity framework. Let's learn from the healthcare executives who are using the framework for their overall organizational improvement. It is my distinct pleasure today to introduce Ms. Debbie Cardello. She is the Performance Excellence Coach with Strata Group in Florida and is a senior Baldrige examiner. She has lived the Baldrige journey as Chief Operating Officer of Robert Wood Johnson University Hamilton Hospital and as an internal coach with Stura Group. Under her leadership, both of her organizations were recognized as National Baldrige Quality Award recipients. And next to Debbie is Dr. Glenn Crotty. He is a clinical associate professor of medicine, executive vice president, and chief operating officer of Charleston Area Medical Center, West Virginia. And he serves as a judge for Malcolm Baldrige National Quality Award program. Dr. Crotty oversees the operations of 924-bed 4-hospital system and has led the change of CAMC's quality program. His organization was awarded National Baldrige Award in 2015. And next to Dr. Crotty is Ms. Paula Freeman. Paula is a senior vice president and chief strategy officer of SSM Health System, which operates 4 states where the SSM Health's program goes. Her organization is the first healthcare organization to win Malcolm Baldrige National Quality Award. And she has served more than 10 years with Malcolm Baldrige National Quality Award program, both as an examiner and as a judge. And she has joined us from St. Louis, Missouri today. She is with SSM Health for the last 26 years. So we are fortunate to have such a diverse panel of senior experts who have experienced the Baldrige journey firsthand. And we would like to look forward to your viewpoints and experiences. So before we start our panel discussion, I would like each of you to have a little bit of your insights and key motivation to begin Baldrige journey, because in my opinion, Baldrige saves lives, and it really works because in each healthcare organization, no matter if you are in the administration or in a clinical, working in a clinical setting, if you are aware of the seven frameworks, and we have some excellence builder booklets outside for you can go through those and see how Baldrige is helping healthcare organizations improve their excellence. So I would start with Debbie.
Okay. Working? I think I'm the one with the microphone, so I'm the one that's going to go first, right? So we had a little chat up here, and we thought we'd like to know a little bit about you. Is there anyone right now who is either on a state performance award journey or a national, any experience with Baldrige or Performance Excellence Award? We'd love to see a show of hands and maybe chat with you. Could we get, is it possible? Yeah, oh, thank you so much for the microphone. Thank you.
Hi, is it only present or
No,
past?
past too, yes, just experience with the process.
Right, so at UF Health Jacksonville a few years back, we were recipients of the Florida Governor Sterling Award, which is based on the Baldrige criteria, and then we're recertified a few years later. So a lot of our performance improvement activity was based, and structure within the organization was based on the Baldrige criteria.
Wonderful. And you mentioned the Sterling process. So most states have access to a state quality award, which is somewhere to think about beginning. So congratulations on that journey. Who else? Did anybody else want to tell us a little bit about their experience? Okay, so my experience, I was very fortunate to work in two organizations who really embraced the Baldrige criteria and went on that journey, took that leap of faith, learned about the criteria, went on the journey, and ultimately received recognition. One was Robert Wood Hamilton, I think Noreen said that, and most recently Studer Group, 2004, 2010. And we saw extreme value. It was almost like a before and after at Hamilton, my hospital experience. So I'll give you examples from both throughout the session today. But why we went on the journey, and I'll be very transparent with you at Studer Group. How many of you know of a fellow named Quint Studer? One day, he came to a meeting and he said, you know what? A lot of our partner organizations are talking about Baldrige, and they're on this Baldrige journey. So he said, I think we should do Baldrige. So who's going to submit an application for this? And I'm like, whoa, I was an examiner at the time. I'm like, submit an application? Like he thinks we're just going to submit an application and win. I know that's what he's thinking. So yes, I said, okay, I'll take point and we'll get started on this. Well, it wasn't until the first feedback report that you get, and you'll hear a lot about that today, right? You got a feedback report, that really a ticker went off, so to speak, and the wake-up call came in. He looked at the report and he went, I don't think we're as good as we thought we were. And he said, maybe we could learn something from this framework. And I'm like, yes, that's exactly what I wanted to happen. And then we went on a journey, not just submitted an application, and that's such a big difference, because a journey implies that you apply, learn, improve, apply, learn, improve. And it took about 4 cycles at Studer Group until we achieved that level of excellence where we got recognized. So I'm glad to be here today with you and share any of our learnings and hope that we answer every one of your questions as well about the process. Thank you.
Thank you, Deb. Charleston Area Medical Center started on the Baldrige journey back in 2005. Our first application was in 2008. It took a little while to write an application. It took a lot of understanding of what the terms meant, what they were really asking for. It isn't just very easy and simple to understand all the parts and pieces to it. But it was very funny at the time because we at that time were part of the HQID project through CMS, and the Charleston Area Medical Center and Hackensack were like 1 and 2 in the quality measures and the quality reporting. And we thought, well, this should be pretty simple. Our quality is great. We should just be able to write a story and they'll give us the award. It doesn't quite work that way because there are pieces and parts of an organization that are very important to your overall quality. And having your strategic plan, having the leadership system, all coincide with the intelligence from the voice of the customer system. They're very important to your organization and for the organization's sustainability. And needless to say, in 2008, we got a feedback report, and it was very eye-opening because we were sort of at the bottom of the barrel in terms of the level of scoring, but it gave us tremendous feedback. And feedback you don't get about an organization any other way, because the Joint Commission or DNV or the other organizations come into your organization, they look at a piece or a slice of your organization. And the auditors who come in and audit the financial piece come in and give you a slice of your organization. But where does it get put together in terms of the quality of your processes in a report? There's no other system that gives you that kind of feedback as the Baldrige program does. And that feedback is worth its weight in gold. You may agree with some of it you may not agree with, but the feedback really gives you insights into how your processes and how they think your deployment of your processes really are occurring. And it also establishes a system and a pace to your learning. And it took us 10 years to achieve the recognition. But it wasn't about the recognition. It was about putting in processes and procedures and learning from other industry. Because we learned a lot from Toyota. We learned a lot from GE. We learned a lot from other organizations who were Baldrige winners along the way. SMS, who was the first winner. And seeing Sister Mary Jean Ryan talk at the National Quality Forum was very inspirational in terms of their journey in it. And one of the key things she said was they asked us about our mission statement. And they asked us how we measured our mission statement. It's like, holy cow, what in the world were they talking about? And so that led Sister Mary Jean to look at the way they did their measurement system entirely different, right? And so it became very crystallized and very clear that you really needed to have a good measurement system. You needed to have a comparative system to know how well you're doing. So how do you know? The key question. how do you know how well you're doing? And there are many, many processes in an organization. In our electronic health record, we changed 850 processes going from vendor A to vendor B, and software A to B. And, you know, it's how do you know those things are all working right? So it is a journey along the way. There's lots of learnings. Set up a system to learn, set up processes to learn, go learn from other industry outside of your own, because there are many valuable learnings. And we learned from Toyota about the top 5 board. And in every department, talk about deployment, in every department in our organization, every nursing unit, every physician's office that we employ have a top 5 board. And that is 1,200 roughly improvement opportunities that our organization has every year. Think about that. Think about the power of that. And that it's all integrated and aligned with our mission and our strategic plan. Think about the power of that in an organization and getting that line of sight clarity from A to B, and having your improvement engine running all the time in the same direction.
You know, at SSM, you know, our improvement journey, you know, started in the early 80s. And so then our system didn't have a lot of good healthcare comparisons. And so we did a lot of sort of out of industry, sort of one-off conversations about how to improve. And we had adopted much of the continuous quality improvement principles within our organization, and did research with Florida Power and Light and others that were early in the industry. And so when we decided to use Baldrige, it was very selfish. It was really an attempt to figure out a way that we could get better faster. We had a lot of great improvement going on all throughout the organization. We had a lot of well-intentioned people doing really good work. But what we found out is that we had a lot of pockets of excellence kind of surrounded by shades of dysfunctionality. And so we used to call it sort of pockets of excellence surrounded by the DMV, which for us is the Department of Motor Vehicles, where, you know, you'll go and you'll wait an hour, you get up to the counter, and it's like, well, you needed this 4 pieces of paper, not these 3 pieces of paper, and they'd send you back to do it again. And that's kind of what was happening with us. We had some really great facilities, and what we found was that those people at the top tended to stay at the top in terms of their performance. Those at the bottom tended to stay at the bottom. And we had to figure out a way to, how do you fix that? And so fortunate for us is we had a senior leader, we had a CEO, Sister Mary Jean Ryan, that was personally really committed to improvement. And it wasn't simply for the accolades, it wasn't for the awards, but it was for the benefit of the people that we serve. And so first and foremost, we're a ministry. And so we need to care for the individuals in the communities where we have a presence. And so the business part of healthcare just happens to be our business, but it really is about caring for the individuals. And so for us, Baldrige was the best way to get better faster. Wonderful learnings from the feedback. And frankly, it's this process of answering really hard questions that we learned. Not learn the criteria, although we did that over successive periods, but learned more about our business, about why do we get the results that we get, and what are we doing intentionally in order to change that, to improve it. Not just sort of random, not just all the activity, because everyone's busy. Everyone's busy 110% of their day. And so there's no more that you can squeeze in. But what can you do differently to get different results? And so the criteria really helped us to better understand our business and better understand the connections between our business. And so for us, after 10 years of continuous quality improvement, we were high on process and low on implementation. We weren't doing it systematically. We trained a lot of people. A lot of people were doing really great improvement work on various teams, but it wasn't always connected to what was strategically important to our business. and it wasn't always generating results. And so for us, the use of the Baldrige criteria allowed us to better connect the process of the work, the approaches, the deployment, sharing it across the organization, getting and generating all that learning, and then ultimately making sure that it's generating results that were meaningful to us, that were strategically important to us. And so for us, it took us 4 tries of successive feedback reports to finally earn the Baldrige recognition. And it was well earned. We had won state quality awards before that. Many of our individual hospitals had applied for their state quality awards and had learned from that and had done well. But Sister Mary Jean wanted to earn it as a system because she felt we needed to be more unified as an organization. And that was back actually well before all of the new work that you see today, where organizations are trying to become one. These healthcare systems are becoming, whatever your system name is, health versus just healthcare, making it more integrated, making it more unified as a way to lower the total cost of care, get more consistency, get more reliability, and function more like a system. When we did it back in 2002, we were just trying to move from a loose confederation of hospitals to a more unified benefit of being part of a system that was more consistent in how it was able to achieve results.
Thank you. Thank you so much for these remarks. And I would like to start our panel discussion. Let me start with Dr. Crotty. My first question would be, why did your organization decide to pursue the Baldrige journey? I mean, you had explained a very given a thorough description of your mission statement, but why did you decide that you will use the Baldrige framework other than not using any other framework?
I think the biggest key in that was the learning that we needed to improve as an organization. And it wasn't just in the quality department, but it was in the HR department, and aligning the HR department with the strategic planning process, aligning the finance department with the strategic planning and the budgeting process, aligning the leadership system and how we led and governed better to align the goals, because we used to have 40 goals every year, and those goals those were activity goals. And being a measurement kind of person, that made my skin crawl. So we just had to change as an organization, and the Baldrige gave us a framework to do that, and everything was about the how question. So how question is, what's the process? What's the process involved? And who does it? What do they do? When are they going to get it done by? And how do you know it's going to be an effective process? And then what's your cycle of learning? So we had to improve as an organization. And that was because our organization is in an area of that has a payer mix of 16% commercial. So we have to be efficient. We have to be effective. We have to be as mistake-proof as we can be in our processes, and so that we are sustainable into the future. So creating that sustainability path for our organization was very key, part of why we got into the Baldrige criteria. And it becomes getting the feedback was the key to learning about ourselves and learning about our processes and where we weren't doing so well. And it takes, as Mickey Mantle always said, feedback is the breakfast of champions, although his was bourbon and beer. But this becomes a team sport in this effort.
Thank you. And who was involved in the self-assessment process? I have, like I always say, that Baldrige is not an audit; it's a reward. And we tell our children that it is a reward or punishment. You learn both ways. So punishment sometimes does not work, and I think reward does work. And it's the self-assessment process an organization go through to be rewarded. So my question is from Dr. Crotty that how did you do the self-assessment, and how did you have the buy-in for all the, it's a huge setup, it's a huge organization, for having the buy-ins from all the physicians, then healthcare providers, administrations. How did you involve them in the process of self-assessment?
Well, we created teams for each category, and we had a wide variety of individuals on our team. We had physicians on our team. We had senior leaders on our teams. We assigned the senior leaders categories. We assigned senior leaders sustainability factors. We created a sustainability system out of the criteria, and we assigned owners for each of those sustainability pieces. And we had coaches. We had wonderful coaches who helped us along the way. But those coaches helped us think about things. It's like professional golfers. They all have a coach. A football team has 10 coaches or 20 coaches, and if you're like the Patriots, you have coaches in the sky that steal signals and things like that. But yeah, you have to have coaches. So you have to have some humor too. But it became a process, and we met with regularity, and we met and looked at our process, and we looked at data, and then we iterated. And it takes multiple iterations of the processes in the category teams. And we learned to create out of the 200 and some how questions, 32 systems. And when we got down to 32 systems, a system on leadership, a system on governance, a system on ethics, it became more manageable. And it became a much more manageable process in that. So it engaged a lot of the organization, and also deployment of our Transforming Care Together, which was our top 5 boards. We went at that systematically. We learned. We started with 3. We learned the prototype. We then went farther, faster. But it took us almost 4 years to deploy our top 5 board Transforming Care system. And that was intentional. It wasn't you just learn this in a seminar and you go do it. We engaged and enrolled the staff. And we engaged the nurses as well in this because they were the front lines and they were improving processes, but it didn't align with their ladder system. So we aligned their ladder system in our organization with the top 5 board. So if they worked on processes and made improvements, they got ladder jumps, which meant $3 and $4 an hour improvement in their compensation. So it's those little things that helped our organization gain the buy-in, and that got the rewards, that got the recognition. And now it's a machine that keeps on rolling.
Great. I think engagement is the key to success always. And my next question is from Paula. Did any of the self-assessment results surprise you, and why?
Yeah, we had a lot of surprises along the way. You know, in our first application process, we thought we had it down, and so we really did. We had made a lot of changes, sort of pre-application, and one of them is that one of the questions for Baldrige under the leadership category, it has to do with mission, vision, and values, and then how do you systematically communicate that throughout the organization. Well, each one of our hospitals had its own mission statement. And so at the time, I think there was, 19 or 20 hospitals. And so Sister Mary Jane had asked one of our leaders, so something about the mission statement. And the answer was, well, which one? Is it the system one? Is it mine? Is it the one for the region? Which mission statement? And we embarked upon, a multi-year process to actually get input from within the organization, about 3,000 employees, to recraft a single mission statement, which is now used. This was developed back in 1999 and is still used today to really be the framework for what's important to us in the organization and how everything else cascades off of that. And it went from 26 pages of single-spaced mission statements down to 13 words. And it's through our exceptional healthcare services we reveal the healing presence of God. And so we were so excited. And so we're like, okay, we've got this in here. Here's our mission statement. The Baldrige examiners are going to just love this, that we've gotten this just so improved. And we had spent the last year trying to figure out, how do you reveal the healing presence? Because it's all about care delivery. It's all about that patient connection piece. And the Baldrige examiner said, well, you say you want to be exceptional, but all of your comparisons are against your competitor down the street, or it's against your averages. What's the average of this or the average of that? It's not exceptional. And so through there, we really started to rethink, what are we trying to get at? And so from that point, we started to actually put in best-in-class comparisons. And back then, they weren't as publicly available as they are today. And so a lot of that was developing consortiums and collaboratives to proactively share information so that we could get other good comparisons and then use that as the threshold. Also, we found out that a lot of times we thought we were communicating, but we really weren't. And so Baldrige assesses not just your approaches, do you communicate, and who do you communicate to, who are your key stakeholders, and what are the ways that they get information from you, but how effective is it? And so one of the questions is, well, how do you communicate to your physicians? And we said, oh, well, every facility has their medical staff meeting, and a lot of information is shared there. And they're like, great, how many people show up at the medical staff meeting? Well, it was about 12%, right? 12% of our physicians showed up, on a semi-routine basis. And so then their question was, well, what do you do with the other 88% that don't show? And it was the same with how we communicated messages throughout our facilities. And so a lot of times messages would go out to the units and they'd be posted on a bulletin board or something thereafter, or they'd be communicated, but it'd only be communicated to the day shift and not the night shift. Or it would go on to a board, but no one read the board. And so we think we're being so awesome at cascading information, and then we're more and more surprised that people have no idea what we're trying to achieve, or what the goals are, or what the performance is. We have department posters and passports. And so posters is basically, it's a department poster in every one of our units within the hospitals and every one of our medical office buildings. And then every individual has a passport about what can you do each day to contribute to the mission, which is really the framework for our strategic plan. And in the departments, it then talks about what is it that you're working on to improve in each of those characteristics of exceptional. And so most of that is clinical safety or service. It's something around value. How do you lower the total cost of care to make things more affordable? What are you doing to get engagement of the workforce, largely employee engagement, physician engagement, and then what are we doing to grow? And so all of those things are listed on there, but we make it so difficult for our department managers to get the data easily to understand, what do you do when something's off? What do you do when your expected performance is so markedly off from what you expected? How do you go to get to that root cause information? Do they have the tools they need to be able to go ahead and make those changes? And so we found out a lot of gaps in our deployment processes where we thought we had it down, but at the end of the day, it wasn't as robust as we thought. We also had a lot of issues where things weren't connected. You had great information that was being used and great results being achieved in one region, but another region that had the very same problem didn't have any clue that there was an improvement team doing that very same work. So the learning and sharing across the organization we thought was occurring, and it wasn't. So subsequent to that, we put together systems in place to be able to say, if you are consistently at the top in terms of performance, you need to partner and mentor one of our entities sort of in the bottom third and share information. That's one of your obligations. If you're in the bottom third, you need to rise up to successive levels of improvement, and there was built-in reward and recognition systems to that. Because that was the other thing is we wanted improvement. We wanted that progressive improvement in terms of overall results, but our reward and recognition system wasn't there. And so Glenn's idea of putting that in terms of the career ladders makes a ton of sense, because so much of what we do is just not all interconnected. And that was one of the big ahas in the Baldrige process about how interconnected all of the different categories are. And for that made us much more systematic in the way we do things. It made us much more effective in the deployment of each of those systematic approaches that were being developed.
Thank you. Great insight. Debbie, my next question is from you. You have been a part of two healthcare organizations winning the award. So what changes did you make as a result of self-assessment process?
Well, I'll talk about Studer Group. That's the most recent in 2010. And what we learned was all about measurement and analysis. Now, I want to try to keep that interesting because it was a little dry. Before I forget to tell you, any of our applications from any of our organizations are available for you to review on the Baldrige website. Just so you know, you could pull any winning application and get a sense of what they look like, what questions they ask, and what results are put in. It's baldrige.nist.gov, and all the recipients' applications are on there. So back to measurement. At Studer Group, they gave us feedback that we had pretty robust processes that were customer-facing, but internally not so much. And one of them was related to measurement and strategic planning. So let me give you an example. We had a 90-day action planning process. Anybody look at their action plans every 90 days? Let's see a show of hands. You develop action plans, and then you kind of bring them out, brush off the dust, and update them. Well, that's what they sort of found with us. We were doing 90-day plans. We were very proud of those 90-day plans, but it really wasn't a robust process. So what we did is, and you could apply this not just to strategic planning, but any initiative that you're trying to improve. We put a hard stop in place, and we got those teams together, and we said, where are we with this goal? And not only the outcome part of that goal, but the process part of that goal. And let me give you a hospital example. So let's say one of the goals was to improve the patient experience. How many of you have that goal? I knew I'd see a lot of hands go up with that one. So we would do an analysis. Where are we with that goal? What's our current result for this quarter, the 3 months in this quarter? And then we would add what we would call lead indicators. So if you're a hospital, you may want to know about, let's say, responsiveness of the call light is one of the key things, right? So instead of just looking at that result, we would add lead measures such as, well, how long does it take to respond to a call light? What statistics could we get? What units do it better than others? So do a deep, deep dive. And we did that quarterly on, all our key strategies. And that really helped us improve and focus. And we went down from about, Glenn, was it you that said you had 17 goals? That was another lesson learned. How many things could we really accomplish in 1 year? The more, there's some research, I can't spit out the author, but they said the more that you focus on in any given year, the less result you get. So we pared that down. We couldn't get below 12. But really, how many things could we change per year? So we really, less is more. So that certainly could be, one lesson learned. And our last one was a lot about measure what you seek to improve. So while we had strategic measures, what we didn't do so well is follow our work processes. And I'm sure we'll talk a little bit more about process management. We were very weak on process management. And I find hospitals that I work with, that's their biggest opportunity too. In fact, when we were assigning the process category, you know, Noreen said there's 6 categories. The process category back in Hamilton Hospital, we drew straws. Nobody wanted it. We were all afraid of it. We said, I don't want the process category. I want strategy. I want leadership. I want customer. I wanted customers. That's sort of a sexy category. But process management, not so much. So that's a big opportunity that I see as I work with hospitals, and we experience it with Studer Group. And we'll certainly get to more stories about process management along the way.
Sure, thank you. My next question is from Paula. What did you find most helpful in using Baldrige standards, and what was most challenging for you?
You know, for us, again, it was that organization as a system, as opposed to all of the way that we tended to manage the business before getting much more serious about the Baldrige criteria. You know, part of our issue is that so much of the way that we're organized for our work is by department. And so you work in this department or this hospital or another one, or you work for the medical group, or you work in post-acute care. And that was how we managed. Baldrige helped us to kind of rise above that and get much more horizontal, to look at how easy is it to access our system? What are the ways that we admit patients? What are the way that we do assessment? How do we do care delivery? How do we do discharge? And we looked at much more horizontal looks across the organization, not just management by department. And so that's how you get that continuity of the entire patient experience, not just effective pieces surrounded by levels of inconsistency. And so for us, that was very, very helpful, along with making sure that, you know, focusing on really great results, which is what we were trying to do before, that was very disconnected from the process work that we were doing. And so we started to really get much more serious about paring down our strategic priorities. We had 40 to begin with. And when you start with 40 priorities at a system level, by the time that gets down to the unit, it's hundreds. It's ridiculous. And so we had to have a process where we needed to do a formal exercise about things that we were going to take off the plate. So we did sort of a stop, start, and continue. We're going to stop doing this because it's unrelated or it's not a priority. We need to start doing this because we're not doing it consistently. Or here's some things that we need to continue because of regulatory or patient safety reasons. And we got it down to top 5 goals. And so those 5 goals were in each of our characteristics of exceptional service, and then it cascaded from there. And we used what we called sort of a tight, loose, tight philosophy. Tight at the top. We're very clear on what the goal is. Loose on how you get there, because we really felt that the input in terms of the specifics on the strategies would best come from closest to the processes, and so within the regions, within the entities. And then tight at the end of the day, tight on accountabilities. And so when there was an issue or when there was a variance, we would talk through that. And so that part was very helpful for us. We had to laugh earlier in our process. The joke was it was tight, loose, loose. We're sort of clear on where we need to go. We're loose on how you get there, and nobody held anyone accountable. And so we were a little too Catholic nice. Now we've kind of gone in the reverse. Most people say it's feeling pretty tight to me. You know, tight on what it is, tight on how to get there, and tight on the accountability. But we're working to sort of moderate that. You know, the challenge for us is you have 50 pages to tell your story. And we had a really hard time telling our story consistently in a unified voice, in a unified fashion over those 50 pages. And it's 1,000 points within those 50 pages. And so, you know, about 450 points or so is results, and the residual is process. And we just wanted to share all the great things that we were doing and not really talk about how did we get those results. And so, positive or negative, why do you get the results that you get? And we've learned a lot from that question. And we've learned a lot about how to really drill down into root cause analysis and to really figure out When do you intervene and when don't you intervene? How long do you wait to see changes and variation before you take an action? And what is the real root cause there? And trying to teach that skill set over 40,000 people is really hard because it gets complex fast. And early in our processes, the Baldrige criteria was actually more complex in 1999 than it is now. They've done a wonderful job about making it easier to understand and a little bit more fluid. Although I find it fascinating that really it's almost identical. I mean, it's been morphed a little bit to make it easier to understand, but the concepts are the same. And so what does that tell you? For the last 30 years, these principles, these characteristics of high-performing organizations haven't changed. It's foundational. They've revised it. They've added new criteria to be more relevant to current issues and trends like cybersecurity, like ethics and transparency of information. But that core really does make a difference. Early, we were convinced that healthcare was different. We're more complex, we're not like widgets. We serve patients. They have comorbidities. They have other issues. We've got a complex system. We're in multiple markets. There's nothing that we can learn from other industries, and that was so wrong. And so we get some of our best learnings from other industries. As you've heard, from this morning's sessions with a lot of the patient safety work, crew resource training, things that we find from the nuclear industry, things that we find from the airline industry is all applicable in healthcare. I think we're going to find that as healthcare continues to morph and you look at the impact of Amazon and Google and all these other disruptors coming in, we're going to be able to learn even more about how to be a more consumer-focused delivery system. And I think tools like Baldrige, Lean Six Sigma, others, that helps us to get more disciplined in our processes is really essential for us to be able to lower our input costs, lower the total cost of care, and continue to focus on the core of the business in healthcare, which is clinical and safety. So if we get that wrong, then there is no business there. And so the thing I love about the criteria is it really helps you understand your core business much better than you would on your own. I agree with Debbie, though, Category 6, which is process, we still struggle with it, frankly, because what is your core business and what are you good at, right? It's changing, it's morphing. And so the questions are reflective in nature, but answering those hard questions really does help you figure out what are your strengths, what are your the core of what you do, because you may find some surprises in there as you go through, and that learning is really invaluable.
Great, thank you. And other than my next question is Glenn. Other than the hurdle of the page limit Baldrige offers for the application process, what did you find most challenging in applying for the award, and why?
Well, there are two hard things in the evaluation process. Hard for organizations, especially the bigger the organization, the harder they are. One is deployment. How do you know that you've deployed a policy to all 40,000 people? And they understand the policy and how to carry out that policy. Easy, right? You send a memo and you put it online and you have a version in somebody's desk drawer that was from 1988 and you...
We only have 7,000 nursing policies.
Yeah, right. And so the deployment becomes a key challenge. And what's your systematic process to deploy information, education, and training on a regular basis? Because things happen throughout the year that you have to inform the staff, the medical staff, the residents, and all the learners in your system of that. And for us, it's about 8,000 bodies that we have to deploy that information to. and have some judgment of how well they're performing on that policy change. The other hard part in the process as you go along is integrating the work of the strategic planning system and the operations, and linking that with the education, training, and workforce, and developing capability and competencies in the workforce. So all that pieces have to align. They have to go down and they have to go across the organization, and they have to go cross categories. And anything that you do in terms of creating new businesses then have to have the appropriate training, the appropriate competencies, the appropriate planning for the new space, the new building, the new people that are going to occupy that building. How are you going to train them? How are you going to orient them? So those were some of the hardest parts in this as we went along, was ensuring deployment and ensuring integration along the way, and making sure that we had review of our key systems and key learnings passed along the organization.
Sure, absolutely. My next question is from Debbie. I think when Baldrige, you go through the process and you apply to be, a part of the application process and be ultimately the winner of the award. To me, it goes into the genetics, into the bloodstream of an organization, how to perform, how to have process improvement and how to perform excellence at all levels. My question from you is, how do you go back and refer to these changes or reevaluate your processes after you have won the award? Then how often do you go back to reevaluate your processes?
Yeah, process improvement, as I said before, was one of our biggest opportunities. So I brought something with me that I'd like to read, because I'm sure Paula and Glenn never saw a score this low. So if I could ever pull it out. So aside from getting a 0, we got a 10 to 25% in process management. Did you ever hear of a score that low? No, right? First year out, complete transparency. That's why we're here, right? And here's what we got. Few results are reported for the operational performance of work systems and key processes. No indicators presented on the effectiveness of the coaching process. No results for productivity, cycle time, and other measures of process effectiveness. Does not consistently utilize its process design and improvement model. Talk about a wake-up call. We had to start from ground zero. So quickly, to get to where we are today, we had to really think about, and Paul, you touched on it, in order to accomplish our strategy, what are our key processes? Everything can't be key, right? So to be able to do our work, what are the key processes? So those are the vital few. Let's say there was 15 processes that were really important. We had to start standardizing them so that it just wasn't one person doing it one way and one person doing it another way. Because we were a small company when we first started. We were 8 years old when we started the Baldrige criteria. And how we'd answer the question, how do you do travel? We would say, go see Margaret in the travel department. And she did it her way. That was the only way. We didn't need standardized processes. But as we grew, and there was 2, 3, 4, 5 or more people in every department, we needed to standardize processes. So we did just that. And we called it, and you could certainly use anything like this. We called it a 5x5. And we put the 5 big steps to the process across the top, and the 5 sub-steps to accomplish the process on the bottom. Very simple. We were looking for something very simple, and we standardized our processes. Today, as to your question, Noreen, today we have about 200 5x5s. They really morphed to be the most important processes that we want to deploy. And senior leaders really embedded the Baldrige criteria into the way they think. See, it went from being just an application to senior leaders understanding the criteria and running the business by the criteria. They run in the background. We didn't apply again for Baldrige since 2010, but our president, Debbie Ritchie, understands the Baldrige criteria. And she runs the business with the Baldrige criteria. And she knows that you don't wait till something's broken to improve a process. So all processes are scheduled for review. So before we would launch another employee survey or a workforce survey, there would be the first step in the process to be, what worked well last time? What did we learn? What could we do better? Ask the stakeholders, the people that take the survey. Do an effectiveness review before you do a process, and do an effectiveness review every year. So every one of our key processes were scheduled. I mean, we got very formalized with it because we got several OFIs about how loose that process was. So we scheduled them for a review, did effectiveness review, and today I could honestly say it's really embedded in the work of the organization.
Absolutely. And I would say that, add into that comment, the feedback Debbie still carries with her holds a really, really, really huge place in your organization, because you should always go back and look into that feedback and into the comments, because this is a way, it's not only an awakening process you go through every day for your organization, but it keeps you on the path to excel as a organization. So the feedback report is extremely important. Even if you don't win the award, going through the application process and going through getting the feedback report from the examiners, it's an eye-opener, I should say.
Yeah, this very low score really caught our attention. And if examiners, 6, 7 examiners across the country felt that we had that big of a gap, we better pay attention, because we were a company who wanted to advance.
Absolutely.
Thank you.
Thank you. Glenn, I have one last question from you. What organizational gains have been sustained or helped to advance additional benefits or outcomes? I believe that Glenn's organization has saved and millions of dollars following the Baldrige pathway, and this is a huge success. It's not only quality, but I would say it's quantity also, which if you follow the Baldrige criteria, helps your organization. So if you could...
Sure. As there are pieces and parts to this. We started working with Lean and Six Sigma back in 2000. And we've been at industrial strength performance improvement for 18 years. We're ISO 15 certified. So we're very process driven. We have to wring out waste in everything that we do. And over the course of those years, inflation is the enemy of any organization. And you have to be able to overcome the increased cost of goods and services. You have to be able to overcome the inflation of salaries, wages, cost of living. You have to overcome things that go wrong in your budgets. And to do that, since we're not in a market that's actively growing, and we're not, building new facilities in growing markets, we had to become very good at improvement in cost and waste. And the lean processes helped us, and along with the Six Sigma processes, we were able to take out of our organization over $25 million in either cost improvements or revenue enhancements coming through our process improvement system. And to date, we've taken out, this last year we did about 95 million of improvement. So we're well over 300 million over the last 13, 14 years. and that's how we live, and that's how we try to strive to get to Medicare break even, although they keep taking money away from you every year for this or that. So we can't keep up with them, but the processes are ingrained in our system, to look at it. The nice thing with our revenue and going to a new revenue cycle, although it was painful, we found lots of new revenue opportunities that we didn't know we had. And because we were in a system that was rate controlled, previously it didn't matter. When they took rate control off of us 2 years ago, we've been finding opportunities to build things that we never built before because it didn't matter. But now it does matter. And our comparisons against the top hospitals, Council of Teaching Hospitals, we're still below the 25th percentile in our cost of charges. And so that's how comparisons really help you. You know what opportunities you have. And so this improvement efforts, the latest one, we were deferring 300 patients a month that we could not take because our beds were full. Or that we were full at the time that the hospital called. We're a tertiary referral center, and all the small hospitals around us have very little specialists. They have very few surgeons. They have very few other specialists. They rarely have a cardiologist in their communities. And so we serve as their referral center. And so we were saying no to them, 300 times a month. Doesn't take long before they quit sending you anything. And so we've been able to reduce that down to 25 a month. We have more calls for services. We have instituted a prediction model that Roger Resar taught us at the Institute for Healthcare Improvement of how to predict discharges and get those planned so that we can overcome the constipation that our organization has between 10 in the morning and 8 at night, right? Y'all experience that? Yeah, it's constipation. And so you have to put high-grade laxatives to this process. And we did. And we have a noon call every day saying, where are we? And they have a bed meeting every morning and every afternoon. So our organization has focused significantly on that, and that, accounted for close to $25 million to the bottom line this last year. And you just have to be able to see those improvements, get the data, see the improvements, and fix it. It's not about blame. It's about fixing it. Things go wrong, and you just have to fix them.
Thank you so much for very informative comments, and I would like to ask the audience and attendees if anybody has some questions from me or our panelists about the process or how to apply or anything about going through that journey if your organization is interested in following the
So everybody's going to run back and say, yes, let's apply for a vote.
Here's a question. We have a question. Yes.
So there's been criticism over time that it becomes a means at the end instead of just a means to an end. How do you make sure that Baldrige doesn't become so all-consuming that you lose sight of what? The question is, how do you make sure that Baldrige doesn't become the end in itself, and you lose sight of why you're there in the first place.
Yeah, I could begin that. And I do think when you first start out on the journey, there is that learning curve, and it does become all-consuming. So until you really, get on board with the criteria and get yourself educated, which would be one of the first things I would do, as you really embed the criteria into the way you do business, I really think it becomes part of the structure of who you are and what you do. So if you had steering teams, you mentioned category leaders and steering teams, they take on other projects, but the structure, the basic structure for performance excellence stays in place. I'll give you an opportunity to add on to that.
Keeping it into the way we do business and not making this another quality piece. We didn't change any language. We didn't change, what we called our quality program. But we used these principles to enhance our quality program for the whole organization. And yes, it took extra effort on a few people, but we had trained lots of examiners, and so folks knew what the criteria were. And one of the things that helps any organization who's not familiar with the Baldrige process, and whether it's a 10-person business, small business, or a conglomerate like Boeing, is to do the org profile. The organizational profile is a really wonderful tool for an organization to take a look at, and especially the senior leaders. If the senior leaders are not in agreement on who your customers are, what their requirements are, what your strategic challenges are, what your strategic advantages are, what your competitive environment, what your key services, not every service, key services, then you're going to struggle as an organization. And having that, going through that exercise with the org profile really was very valuable. And that's the value of a coach.
Yeah, I mean, for us, we haven't put in another application since '99, but we use Baldrige each and every year. And so each of our category champions at the time during the application years, they all, if you think about it, they're just your functional leads. And so, category 2 is strategic planning. Well, that was my function. And so, I know category 2 cold, right? Our patient experience officer really has category 3. Our chief information officer has category 4. Our chief human resources officer has category 5, which is the HR staff piece. Our chief operating officer has category 6, right? We're all responsible for category 7, and all of us on the senior team take joint responsibility for category 1 leadership. So it becomes really not about Baldrige per se. It's not about the crystal. It's about hardwiring. How do you improve? And I got to tell you, with reimbursement continuing to challenge all of healthcare and the redesign of healthcare continuing to change and morph how we do business, that's going to be a differentiator. That's going to be a key to sustainability. Because as Glenn talked about the successes in terms of being able to get large amounts of dollars out of the system, that's a prerequisite. And so all of us are going to be challenged on how do you lower the total cost of care when your top 2 expenses in healthcare is your supply chain and your labor. And so you can't cut at the point of the pen there in terms of our key clinical staffing. And so you're going to have that core clinical piece intact. And so we've got to be able to get more efficient in our back-end operating processes. But the only way to get more efficient is if you're truly beginning to redesign how you do your work, because incremental improvement just isn't sufficient anymore. And so last year, we've been doing performance improvement seriously to try to really bring down the costs. And now we're a large system, so we're in the Baldrige years, we were about $3 billion. We're now $7 billion. And so it's interesting, we had to make a conscious effort to grow the scale quickly and try to figure out ways to bring out that back-end cost. So for the last 3 years, we've been able to take out almost $200 million a year in total expenses. You can't do that unless the organization knows how to improve. And so it becomes embedded in the culture. It becomes embedded in how you identify people to bring into your organization. So you know how to recruit, you know how to retain those individuals, you know how to evaluate them, and you know how to train them in ways that become interconnected in terms of the core of the business. So I think the ability to improve, the ability to understand your business and know what levers you can pull is really essential to long-term sustainability so that we can compete more effectively.
I would add one more thing to Paula's comment. It's a journey. If we take it as a journey instead of a destination, it becomes easier because we live Baldrige every day in our different processes, and we generate results out of our processes. Applying for the award becomes a little overwhelming, but if you think it's a journey, it's a process, it becomes easier. So it becomes a part of bloodstream for an organization once you start that journey. What it is.
This will be our last question. Go ahead.
So once you're Baldrige, are you always Baldrige, or is there a cycle of reapplication that's expected?
You can't reapply again for 6 years. There are a few organizations who have reapplied and have won again. Midway USA, the Ritz-Carlton, North Mississippi Medical Center, to name a few, have reapplied and won. Some choose not to do it, but continue using the processes. Friesen Nichols has won it twice, and it is part of the fabric. The thing that I miss is the feedback. So we will reapply again in 2021 as the time frame leaves us, and we're eligible again. But they do that on purpose. We've spent a lot of time educating other organizations. We have lots of teaching days, sharing days. We had a sharing day last Saturday for business college students from the Marietta College of the Business in their leadership program. That was a fun morning of just bright kids learning about the Baldrige process. And so we have sharing days, and we give conferences and try to spread the good word throughout that this is an effective mechanism to help an organization continuously improve. Because if you're not improving, you're falling behind.
All right, if you guys could please give our panel a round of applause.